About 2017, our building administrators were coming to us and saying that students were coming to school with a lot of needs, a lot of emotional needs, and they felt like our school administration and our school counselors were not prepared to meet those needs. So what could we do to assist those students who were coming to us? And so Lilly put out a request for grants throughout the state of Indiana to improve your counseling program. So we thought in 2017, several of us got together and we decided to apply for that grant, with the biggest part of it being focusing on mental health. We were very fortunate. We were one of 57 school districts that received the grant, and it was in the neighborhood of $1.3 million. So currently, we have 14 mental health therapists in our buildings, and they kind of work with our students on a day-to-day basis. To date, we probably have helped over 400 students, providing some type of mental health background or counseling for those students.
We've been able to gain a lot with the Lilly grant, so we were able to add some social workers, add mental health services, as Dr. Jensen referenced. Our social workers are amazing. They meet a lot of needs for families that people don't recognize, but they're limited. We have some social workers that are servicing 4 and 5 buildings, and so, you know, ideally we'd like to increase social services for families. You know, we're good at educational services and we have good outreach in educational services, but the expertise goes beyond the educational realm. We need social workers, mental health therapists, the nursing and health components, all of those things collectively wrap services around children. That's the model we're trying to attain, is having a full wraparound service model, so that whatever the need is of the family, whether it's food insecurity, lack of transportation, lack of medical insurance, just how can we help the families get what they need? Because we know that if children can be healthy, they can learn. Our nursing staff would tell you that statistically 1 in 4 children have some type of chronic disease or chronic illness, and that can also be mental health. We're just trying to help meet the needs of families and children with a variety of services, more than just educational services.
In essence, the Lilly grant was given to us for 4 years, $1.3 million. And so in 2 more years, the grant will expire, and we need to find a way to provide these services that I just mentioned: the mental health therapists, the behaviorists, and the social workers in our schools. One of the things we're looking at is a school safety referendum. General Assembly last spring, they passed a law that allowed schools to levy on their tax rate up to 10 cents on the levy to provide money for school safety. And one of the things we're looking at is maybe funding our mental health initiative through the school safety referendum.